anatomy of the neck is composed of many structures such as the cervical spines, spinal cord, blood supplies, nerves, joints, cartilages, and glands. The articulation of the spine and the skull is known as the atlanto-occipital joint, which is responsible for nodding your head, while the atlanto-axial joint is the articulation between C1 and C2, which is responsible for the rotation of your head. The neck is also composed of an important structure which is called the brachial plexus. It innervates our upper extremity, and on the front part you can see the Adam's apple or the thyroid gland. And behind to it is the trachea, which is the passageway of the air. Parallel to the trachea, you can palpate an important artery which is called the carotid artery. And this structure is surrounded by different important muscles which impels movement of the neck. 1. Neck and posture. 2. Shoulder alignment and shoulder level. 3. Muscle spasms or any asymmetry. 4. Bony or soft tissue contours. 5. Facial asymmetry. 1. Age. 2. Recent injuries. Mechanism of injury. 3. Onset of symptoms. 4. Past activities that may cause the injury or pathology. 5. Trigger factors.
For the posterior aspect, first palpate the mastoid process. It is located below and behind the earlobe. It is the point in the skull at which the finger dips inward. The external occipital protuberance may be found in the posterior midline. It is the bump in the midline of the posterior skull. The spinous process and facet joints of the cervical vertebrae. The spinous process of C2, C6, and C7 are the most obvious. They can be palpated at the midline just below the occiput. For the lateral aspect, first palpate the transverse process of the cervical vertebrae. They can be palpated just lateral to the spinous process of the spine. The carotid arteries can be palpated between the sternocleidomastoid muscle and the trachea. It is where the mid-portion of the neck, which you can feel the carotid pulse. The temporomandibular joint or the TMJ can be palpated just anterior to the external ear. The examiner may either palpate directly over the joint or place the little finger or index finger in the external ear to feel for the movement in the joint. The thyroid cartilage or the Adam's apple can be palpated at the level of C4-C5 vertebrae. It lies midline anteriorly on the neck. It can be easily moved just by swallowing. The hyoid bone can be palpated as part of the superior part of the trachea above the thyroid cartilage anterior to C2-C3 vertebra. The supraclavicular fossa is a smooth indentation and can be palpated just above the clavicle. And just below the clavicle is the first rib, where it lies lateral to the manubrium of the sternum.
Temporomandibular joints are the two joints connecting the jawbone to the skull. It is a bilateral synovial articulation between the temporal bone of the skull above and the mandible below. It is from these bones that its name is derived. This joint is unique in that it is a bilateral joint that functions as one unit. Since the TMJ is connected to the mandible, the right and left joints must function together and therefore are not independent of each other. Normal movement of the mandible depends on proper function of the TMJ. 1. Symmetry of the face. Note for any deviations. 2. Occlusion of the jaw. 3. Facial profiles. If the patient is orthognathic, retrognathic, prognathic. 4. Is the tongue resting normally? 5. Swelling of the jaw. 1. Pain or restriction in opening and closing the mouth. 2. Duration of the pain. 3. Trigger factors. 4. Crepitus, clicking or popping sound, tenderness. 5. Locking of jaws. 6. Missing teeth.
In examining for the patient who has mandible fracture, let the patient bite a tongue depressor and ask the patient if there is any pain around the jaw.
The functional or full active opening is determined by having the patient try to place 2 or 3 flexed fingers within the mouth opening. This opening should be approximately 35 to 55 millimeters. Normally, only about 25 to 35 millimeters of opening is needed for everyday activity.
With opening and closing of the mouth, the normal or off movement of the jaw is smooth and unbroken. That is, both temporomandibular joints are working in unison with no asymmetry or sideways movement, and both joints are bilaterally rotating and translating equally. Any alteration may cause or indicate potential problems in the temporomandibular joints. To observe any asymmetries, opening and closing of the mouth must be done slowly. If deviation occurs to the left on opening, a C-type curve, or to the right, a reverse C-type curve, hypomobility is evident toward the site of the deviation, caused either by a displaced disc without reduction or unilateral muscle hypomobility. If the deviation is an S-type or reverse S-type curve, the problem is probably muscular imbalance or medial displacement as the condyle walks around the disc on the affected side. The chin deviates towards the affected side, usually because of spasm of the pterygoid or masseter muscles or an obstruction in the joint. Early deviation and opening is usually caused by muscle spasm, whereas late deviation and opening is usually a result of capsulitis or tight capsule. Pain or tenderness, especially on closing, indicates posterior capsulitis.
That's all. Bye-bye.